The Health Ministry here in Singapore has reactivated a scheme set up during the haze and the H1N1 outbreak. Hundreds of GP clinics will be providing subsidised treatment, investigations and medication for patients with respiratory symptoms.
And all this in a bid to better detect and manage COVID-19 infections. There are 9 new cases confirmed today, bringing the total number to 67. Cheryl Goh tells us more.
The reactivation of the public health preparedness clinics shows the government is taking more efforts to manage the COVID-19 virus by filtering them down to the community and primary care level. The aim is really to better manage and detect COVID-19 infections. The Health Ministry has observed that many of the local confirmed cases had continued to move about in the community or go to work when they were ill. MOH has since given guidance to doctors to give patients 5 days of sick leave for patients with respiratory symptoms so they have enough time to stay home and recover.
We have learnt more about the nature of the virus based on emerging trends in China and around the world, and also based on research that various experts have done. And it is clearly emerging now that COVID-19 is different from SARS. The transmission mechanism is closer to H1N1 or influenza. And our own researchers, our own people at the National Center for Infectious Diseases, looking at the cases within Singapore, have confirmed this. Because like influenza, they have found that COVID-19 is infectious when the symptoms are mild. Because of this transmission mechanism, it is also the case that COVID-19, like influenza, can spread quite quickly. In terms of severity, COVID-19 is also different from SARS. And we've said that before. If you look at the mortality rate in China, overall it is lower than SARS. Outside of Hubei province in China, it is even lower. Outside of China, it is low too. So mortality rates are lower than SARS.
The HPCs have been activated in the past during the H1N1 influenza pandemic and during bouts of haze. This time round, 900 designated GP clinics will be progressively activated from next Tuesday to provide care for patients with respiratory symptoms. The clinics will be given clear guidance on the right care protocols to assess the risk and diagnosis of each patient. The staff will also be given personal protection equipment such as gowns, masks and gloves. The public can check flugoware.gov.sg for the full list of clinics. The task force reiterated that this is not a change in strategy in dealing with the virus.
It is an additional layer we are putting in, an additional line of defense we are putting in place, really so that we can intervene early in the infection and detect and pick up more cases before without realizing it themselves. You know, when they are feeling unwell, they may well be infected, and then they're out and about, continue going to work, thinking that it may be very mild and not realizing they are infected. So this is really an additional enhanced detection and surveillance that we are putting in place.